Hi, Dr. Phil. My name is Alice Butler, and I've been a nurse for 23 years here in Florida. And the product that I invented is going to be geared to the geriatric population and to us baby boomers, who are the next generation of geriatric population. And believe me, we do not want to follow in our parents' footsteps when it comes to this product. Hi, Dr. Phil. I need to explain to you what my product attaches to before you be able to understand why we need it so desperately. In the nursing facilities and in the rehab facilities, many of the patients, because of elderly or because of being rehabilitated, cannot stand for long periods of time. So what we do, we have this shower chair, we call it, and of course this is my pint size that I made from PVC piping and glue from Home Depot for my sample that I bring around to the different nursing facilities. It's PVC piping, it's called the shower chair, and people that can't stand for long periods of time, as you can see, there's a toilet seat on the top of this shower chair. We put them on the toilet seat and they take their shower. Now they're sitting in the shower for about 20 minutes or so. And unfortunately, being more so the elderly than the rehabilitative, but it does happen to the rehabilitative patients also, they end up defecating on the floor. And it's very embarrassing to the patient, it's embarrassing to the CNA and the caregivers that are taking care of them because it's a big mess to clean up. Now we come to my invention, and it is patented, and it is being used in facilities here in Florida. And let me show you what it is. What I did is I made straps that connect this lower mesh material down below the shower chair. Now I made them where they fit any size shower chair. And what the CNA does before they give the patient the shower, I call this the liner, the shower chair liner. And they put it underneath these holding straps on each side of the chair. And when they're bathing patients, it could be used because it's dry. If it's not used, they could just leave it there because it could be dried and used again. It doesn't fall apart. It's made out of a non-woven material, so it's able to hold up to, 5 pounds of peanut butter. That was my testing. And what happens if the patient does defecate or there is, excess soil? The CNA, all they have to do is take the corners, pick it up, and throw it in the wash. No, in the wastebasket. And then they just replace with the new sheet. It's less embarrassment for the patient. It's more dignity for the patient. It's more dignity for the nurse's aide because nobody likes to clean up poop. They don't even like cleaning up dog poop. That's why we have the poop scoopers. And it's something that's needed in the facility before us baby boomers go, and we are geriatrics, and this is happening to us. So please, I have a patent pending. I am very passionate about getting this out on the market, and it's just a disgraceful situation that the medical field has never addressed, and I could understand why, because the patients are just too embarrassed to tell family members or to complain about it. And the CNAs, believe me, they complain so much about what's happening here, but we don't have any product to help prevent it. So after 23 years of hearing complaints, I decided to do something about this. So help me get it back on the market. Thank you, Dr. Phil. Hi, Dr. Phil. Let me tell you about how I started with the shower chair dignity mat also. What I did a sample shower chair dignity mat and made my little shower chair. And I went to all the nursing facilities and explained to them, the DONs that were there, what I had intentions of getting a patent on, because I wanted to make sure that they would want it before I spent all the money doing a patent and so forth. I went to at least 20, 25 different nursing facilities, and every one of those nursing facilities says that it was needed, and if it was on the market, they would absolutely buy the product. And what happened, by the time I did put a patent in, and it is patent pending, and by the time I was able to get all the supplies together and get my business license and get everything started, the stock market fell. And when I went back to these nursing facilities, what I heard over and over again is that they're only allowed to buy from their main distributors that they have licenses with. And corporate had told them they are not to buy from any small businesses, which now I'm a small business. I have all these supplies and I wasn't able to sell them. Even though they wanted it, I wasn't able to give it to them. So I went to the manufacturers. In fact, my district manager of my area, the facility that I worked in, made appointments with the distributors. And I spoke to, I guess I could say it's Medline, and I spoke to the products manager there, and she thought it was a very good idea. But at the moment, she says because of the stock markets, they're not picking up any new items. If I would call her the following January when they get their new, I guess, allowance for new products, to give her a call back, which I did. And I did call her back, and in the meantime, I was continuing to supply my shower chair dignity mat and the liners to the facilities that were using them at the time, and they were very happy with them. And what happened is when she did approach her committee that makes the decisions on the new products, they've never heard of this happening before. And they don't believe that it would be necessary. Well, which basically blew my mind. What I was told from her is that her supplier had told her that that's why they have the buckets underneath the shower chairs in case something like that happens. But Dr. Phil, I want you to go into any nursing home shower chair that has these PVC shower chairs or a regular shower chair. You will never find that bucket underneath the seat because we cannot wash the peri area of the patient if that bucket is there. It's useless. It either gets thrown away or we use it as a garbage can. So there's absolutely nothing out there. I believe the newer facilities that are just opening, they are addressing the situation. And they have they call it a loo that reaches out underneath where they slide the shower chair over. But at least they're addressing it. The older facilities want to address it, but for some reason, I think we're just medically detached because the nurses and the doctors and the CNAs, when we come out of school, we go right into the medical field. And to us, it's not a big deal. But to a patient and myself who was in a business and knew nothing about medical before I became a nurse at 30, and I got on the floor and heard of this happening, I just thought it was disgusting and disgraceful. And I told myself somebody will come up within a couple of years and this will be resolved because this cannot be going on. And what happened after 23 years or 20 years, I'm like, oh my God, this is still continuing. I just can't take it anymore. And that's when I got my pins and my needles and my material and my clips and everything. And I sat down and I would go in on my time off and just measure everything and just started the process. And the CNAs love it. You don't know how many thank yous I get from the CNAs that they don't have to pick the crap up off the floor, which is a horrible thing to say on TV, but it's the truth. And I'm just very passionate. Also, let me tell you how much in debt I've become trying to get this on the market. My husband died 9 years ago, and we had life insurance to cover all of our debts, all of the house. I was totally debt-free. Today, I have a mortgage that is more than what I paid for my house. I had to consolidate all of my debts for one big payment because I was living off of my credit cards trying to get my business going. And I'm just kind of in a pickle here. It's a product that is absolutely needed in the medical field, and it's just a disgrace that it went on for decades and decades with nobody addressing it. It just blows my mind. Well, Dr. Phil, I really hope you're interested because remember, we are the next baby boomers, and we are the baby boomers, but we are the next geriatric generation. And you just keep that in your mind, sir. Thank you for listening today. Bye.